Alright, my name is Abigail Bergen. For today, I will be assessing head-to-toe assessment for my patient Nate. He consented this head-to-toe assessment. I will begin my examination by assessing the patient's skin. I noticed that there is no obvious lesion, there is no discoloration, there is no open sore or scarring. Patient warm is also warm and intact. Next, the patient face is also symmetrical and midline. There is no obvious lesion or discoloration as well. Next, I will move on to assessing the patient's head. Patient's head is symmetric. There is no obvious lump. There is no infestation. There is no lice. Hair is normal on patient's age and ethnicity. Next, I will move on in assessing the patient's lymph nodes.
You'll need to unlock your computer first.
The patient's lymph node through maxillary and by the forehead. Please let me know if you feel any tenderness or pain and if you want me to stop. Okay, good. I don't feel any inflammation. There's no tenderness as well. Next, I will move on by assessing the patient's nose. By looking at it, I don't see any obvious deviation. Nose is intact. There is no lesion, and it is symmetric. I will assess the internal structure of the nose using my otoscope. Alright. Nose is intact and moist. There is no blockage. Turbinates is moist and intact as well. Next, I will move on to assessing the patient's eye. Looking at it, I don't see any obvious inflammation. There is no discharge. Eyes is symmetric. I see that there is a good ocular movement as well. I will use my pen light to check on the patient's 6 cardinal gaze. Please follow the light and let me know. Alright, 6 cardinal gaze is intact. Next, I will assess the patient's pupillary reflex. Just look at straight. Alright. Good. Pupillary reflex is reactive and equal. It's about 3 millimeters in size. Next, I will move on to inspecting the patient's macula. So I will check my otoscope to my eye exam. Alright, just look straight. I see the red light reflex there. I also see the red light reflex on this eye, and macula is intact. I don't see any holes. Next, I will look at the patient's sclera and conjunctiva. Look up. Eyelid is intact and moist and pink. Eyelid is intact, moist and pink. Conjunctiva is intact, moist and pink as well. There is no obvious discharge. Sclera, look up. Sclera is white. The other eye sclera is white as well. I don't see any dilatation on the eyes arteries. Eyelash is also intact and there is no obvious infections. Next, I will move on to assessing the patient's ear. I will change again my tools to the otoscope. Looking at external structure of the ears, I don't see any deviation. I don't see any obvious deformities. Ears is free from any nodules. Tragus is also not inflamed and not enlarged. Tragus on the other side is also not inflamed and not enlarged. I will check the patient's ear by pulling the pinna up and back so that I can look inside the patient's ear. Looking at the patient's ear, I don't see any blockage. Auditory canal is free from any inflammation. Tympanic membrane is pearly gray, which is normal findings. I will move on to do the same thing in the other ear. Pull the pinna back. Again, there is no discoloration, no obvious blockage, no deformities. Tympanic membrane is also pearly gray. There is no presence of cerumen. Next, I will perform a hearing test for the patient using a whisper test and a Rhine test. I will say a word behind you. You just have to repeat it to me.
1, 2, 3, 4, 5.
I will do the same one with the other ears.
1, 2, 3, 4, 5.
Patient is able to verbalize and hear accurately. The next one, I will do a Rhine test using a 512 hertz, and I will activate it using this hammer. So you have to let me know which one you hear first. You hear better, 1 or 2.
Okay.
This is 1. This is 2.
2.
2. This is 1. This is 2.
2.
2. That is a normal finding. Number 2 is usually loudest for the patient using a Rhine test. Another one, I will do a Weber test. So you let me know, where do you hear it best? Middle, both ears?
Oh, again, I'm sorry, I didn't know if I was 1 or 2 or that.
Both ears or middle?
Okay.
Or just left or right?
Both.
Both. One more time.
Both.
Okay, and that is a normal finding as well. Okay, I will put this behind me. This one is done. The next one, I will ask the patient to open his mouth so I can check the internal structure of the patient's mouth. Looking at the patient's mouth, I don't see any open sore on the lips. It's normal, it's moist. And then I will look at inside of the mouth. Patient's adult teeth is intact. Can you stick out your tongue for me? Tongue is intact as well. There is no lesion. Say ah so I can see your tonsil. Tonsil is good. I will grade the tonsil as number 2, 2+ tonsils. Mucosa of the mouth as well is pink and moist. I don't see any obvious lesion. I will check the soft and hard palate. Okay. Soft and hard palate are intact. I don't see any open sore and no discoloration as well. Next, I will perform a lymph nodes. I will palpate the lymph nodes of the patient. I will do this by touching the patient's neck and face. Just let me know if you feel any tenderness, any pain, and then if you need me to stop, okay? And I will use my fingertips, okay? First, I will be palpating the preauricular. I don't feel any tenderness or any inflammation. Postauricular, no tenderness or no inflammation. Occipital, mandibular, and submental. Lymph nodes are not inflamed or enlarged. Next, I will move on to palpating the tonsillar and subclavicular, anterior clavicular, and posterior clavicular. It's not enlarged. This is the tonsillar. This is anterior cervical and posterior cervical. And they are not enlarged as well. Next is the supraclavicular. I don't see any enlargement. There is no inflammation, and patient is not complaining of any pain. Okay. So we're good with assessment of the patient's neck and the patient's mouth. Next, I will move on to assessing the patient's vision I will be assessing patient's cranial nerve, and I will start with assessing the cranial nerve number 2. I will start with number 2 to number 12. Cranial nerve number 2, which is optic nerve, have 2 portions. The first one is the visual acuity and using visual acuity, and the second one is the peripheral vision field. So I will begin by doing the peripheral vision first. That's the peripheral vision. So I will ask the patient to look straight, and I will move an object on the side of the patient's face and see if the patient can identify if he can see it. Just let me know if you can see the object.
Yes.
Do you see it here?
No.
Here?
No.
Here?
Yes.
Here?
Yes. No.
No?
Yes. No.
No?
No. No. Is it just the stick or the black ball?
The black ball.
Okay. No.
No?
Yes.
Yes. Okay. I will move on to the other side of the eye.
Yes. 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 No. 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 Yes. No. Yes. Yes.
Okay. Peripheral vision is intact. Patient is able to see within that parameter. The next test, I will be using a pocket Snellen chart, which is this one, and I will ask the patient to read the smallest letter as possible. And I will stand, I would say about just right here, probably. Hold on. You have to cover one part of your eye and read the lowest letter as possible.
LTFPH.
LTFPH. Okay. Cover the other one.
LTFPH.
Okay. And now read with both eyes.
The lowest one I can read? LTFPH.
Okay. Patient is able to read the lowest possible, which signifies a 20/20 vision. That is the portion for the visual vision test. The next one I will test for the sensory as well as the motor aspect of the eye. This is still cranial nerve number 2, but it has portion of a cranial nerve number number 4, number 5, and number 6. Oh, I'll just use this one again. Okay, so I will ask the patient to close his eyes and identify where am I touching the patient. You let me know where am I touching him.
Forehead, right cheek, nose, left cheek, chin, under chin,
Chin. All right, thank you. Good. Patient is able to identify the areas that I am testing. Next one, I will ask the patient to clench his teeth and make a chewing sound or chew. Make it obvious. Okay, there you go. Okay. All right, thank you so much. Are you good?
Yes.
Chewing is intact. Hypoglossal is intact. Next, I will ask the patient to open his mouth and say ah.
Ah. Ah.
Hold on.
Ah. Ah.
Okay. Patient tonsillar moves at the same time with the words ah. That motor is intact as well. Next one, I will move on to assessing the patient's ocular movement. I'll just use this one. So I want you just have to make your face straight, but your eyes follow the object, okay? All right. Patient's eye movement is intact as well. Ocular motor is intact. Next one, I will move on in assessing the patient's lungs using my stethoscope. For this exam, I will ask the patient to take off his shirt.
You didn't tell me that.
All right. So for this exam, I will listen to the patient's heart sounds, starting from the left aortic valve, going to pulmonic valve, going down to the Erb's point, and then next to tricuspid and mitral. I will assess the patient's aortic valve into the right second intercostal space, moving to the left side, second intercostal space, on the left lungs, on the left chest, going to the Erb's point and tricuspid and mitral. Okay, I want you to take a deep breath. Third intercostal space, Erb's point, tricuspid, and mitral just below the nipple line, fifth intercostal space. Okay. I don't hear any gallops. S2, S1 and S2 is intact. I don't hear any murmur as well. Next, I will ask the patient. We will assess the patient's strength and range of motion by asking the patient to squeeze my hand and do a resistance test as well. Squeeze my hand. All right, patient's grip is intact, and then I have to do a resistance. Okay, I'm going to push you and see if you can push them. Okay. Patients are able to resist. That is also intact. All right, put it down. Next, I will assess for the patient's reflex. I'm going to do the bicep and the tricep. I do not have the hammer, but this is going to be the AKA hammer. You can do the brachial reflex first by putting your thumb in the patient's brachial and by tapping it with the hammer. And if there is a reflex, that means that the patient's brachial reflex is intact. I don't know if this is gonna do it, but it does. Thank you. Reflex is intact. Next, I'm going to do the tricep. You can do this by asking the patient to dangle his arm towards you and relax. Just dangle it. And you can press it right here. All right. Tricep is intact as well. Next, I will do the patellar reflex. I will do this by just grasping the patient's kneecap. I don't know if you can see. Let me just adjust my camera real quick. All right, I think you can see it there. All right, sorry. Grasping the patient's kneecap. Sorry. And putting your thumb right there. And kneecap patellar reflex is also intact. I will do the same one in the other knee. Can you see? No. Hold on. All right, there you go. All right, one more time. Patellar reflex is intact as well. Sorry. All right. Reflexes are good. They are also intact. Next, I will assess the patient's lung sound. I can do this by asking the patient to, you can probably turn around so we can see the camera. Let me see. One more time, like face this way. Okay, hold on. All right. You can test the patient's lung expansion by putting your thumb right next to the lung. The lungs is right here. And if you put your thumb right here together and ask the patient to inhale and exhale, your thumb should spread out. Inhale. Exhale. Thank you. One more time. Inhale. Exhale. There is a good muscle expansion of the lungs there. Next, I will listen to the lung sounds. Okay. All right. Inhale. Exhale. Okay, thank you. I don't hear any murmur. I don't hear any wheezing. There is no crackles. Lung sounds is good. The next, I will begin my my assessment in the abdominal area. I will ask the patient to lie down, and I can start my assessment through inspection, and then do a palpation.
On my back or stomach?
Stomach. Oh, yeah, back. I gotta palpate your lungs. Your stomach. Can you see here? Hold on. Right here. I think you can see. All right, that's fine. Visual inspection of the abdomen. I don't see any obvious hernia. There is no, it's symmetric, there is no lesion, there is no tenderness, and there is no any obvious discoloration. There is the presence of mole, but it is normal at this point. Okay, next I will listen to the abdominal sound for any signs of root. And I will do this in the 9 region of the stomach. One, two, three, 4, 5, 6, abdominal sound is normal. It is normal active. I don't hear any bruit or any signs of hyperactivity. Next, I will do my light palpation and then begin to a deep palpation of the 9 region as well. Just let me know if you feel any tenderness or if you need me to stop. 2, 3, 4, 5, 6, 7, 8, 9. Light palpation is complete. Patient is not complaining of any tenderness. There is no dullness or any obvious hernia as well. Now I will move on to a deep palpation. 1, 2, 3, 4, 5, 6. Is there any pain there? Any pain here? And any pain here? No. Okay. Patient does not complain of any pain. There's no tenderness as well. I will move on to percussing the patient's abdominal region as well. It is dull on the left side. It's because the left portion of the lungs is extending on this region. Percussion is also normal. Next, I will move on to vascular area, which is checking the patient's lower extremity. Is it okay if I just put this up? Patient lower extremity, there is no obvious swelling, there is no edema. Legs are also free from any edema. Then I will move on to palpating the patient's pulses. I'll do 2, pulse is bouncy and regular. Do it this way. Bouncy and regular as well. And then I will also assess the patient's lower extremity skin temperature for any circulation issue. Legs is not cold, it is warm. It signifies a good circulation on the lower extremity. Next, I will ask the patient to do a range of motion on his legs by bending the patient's knee. So I will just relax. Is there any pain? I will do the same one on the other leg. No pain. I will check for a reflex on the patient's feet by tapping the back of the foot. Okay. There's a good reflex there, I'm sorry. And then I will do a resistance as well on the foot. Patient is able to resist that side. All right. Now you can have a seat right here. We're gonna do a range of motion for your hands. Right. Next, I will do a range of motion for the patient's arms by doing abduction, adduction, and rotation. Let's do it that way. Relax it. This is and okay, range of motion on this arm is good. I will repeat the same thing on the other arm. Okay. And then go up. Range of motion is intact on this aspect as well. Next, I will do accessory muscle. I will ask the patient to shrug his shoulder when I put my hands in his shoulder. Shrug your shoulder. Thank you. Accessory muscle is also intact. And that concludes our assessment for today. Thank you so much for your participation.